The cancer patient has a degree of susceptibility to infection by this much greater than I ever realized. And the family members and friends do not. So to protect the sick person, the family members have to get rid of theirs too. They have to get rid of theirs in their saliva and then on their hands, because that's always related. So if every family member gives themselves one dose at about the same time, that's it. And then and that's all. I do ask the sick person to take it several days in a row because they reinfect. Not because anything lives up. It's not from themselves anymore. But the source of reinfection was found. And here, it was my mistake. Okay, I made a mistake in the first book. I said you didn't have to boil butter and cream, didn't I? Didn't I say that? Yes, and in all the books. Now, I have found that you do. I have done more milk studies and cream studies and butter studies, and there they are. They weren't in the brands and samples that I tested earlier, but in the samples I tested more recently, they were there. So it only takes a pat of butter, and the sick person has it right back in their tumor. But if you cover those two areas and take a single dose, that's it. And I don't want to be overly enthusiastic, but because you will find it all out for yourself. And the new concentration is called Black Walnut Tincture Extra Strength, and I have the recipe out for you so that you can make it yourself. I hope it's not too late for everybody and that you can still make it. The dose and everything is given. Some sheets, these sheets were copied. I wanted you to have it without having to wait for the next printing of the book, and I think they are available.
My question is about aflatoxin. I find this a nightmare. I find it very difficult to know what to eat. And I know you're quite specific in your book, but I find it extremely restrictive and contrary to what we had been told was a good, healthy diet. For instance, the brown rice. You say that it is full of ergot, and the white rice is preferable because it does not have it. My question is, what do we eat? What is there left to eat?
Well, I think that should be music to the ears of any manufacturer. It's time for manufacturers of food to make clean food. So that should be a wonderful opportunity and an invitation to all these people out there making chips and this and that and manufactured food to make sure that the aflatoxin level is below what we can detect on our synchrometers, and that we will eat, and nothing worse. And then, well, I think we can just hope that they will be forthcoming. I agree with you, there's nothing to eat. It's so darn polluted. Very little that isn't polluted. But if you stick to the outside of the grocery store, just all around the outside, and never bother going through the aisles, you probably come up with the best diet.
Thank you.
Who's chairing the meeting, I really didn't want to ask Dr. Clark a question at this point, but I did want to make a comment on a couple of other things for everybody here. And a quick thumbnail of where I'm coming from in making this comment to everyone is that I have spent the last 3 years doing an incredible amount of public lecturing on health and alternative health cares in Western Canada and debating on television and radio with various members of the medical professions, registers of the colleges of physicians and surgeons, and so on. And I want you to consider very carefully that most of the medical doctors are doing the best they can with what they have. And unfortunately, my statement, I don't think they have a great deal. But they have memorized, they have been taught, and with what they've got, an infusion, an injection, or cutout, or burnout for a given situation which are symptomatic, that's what they use, and I don't want to ridicule them. However, I want you to be cognizant of the fact that any time anybody, anywhere in medical history, brings up a new approach, new information, it's a quantum leap in a direction, organized medicine will always come up and pose the question to that person, have you done a double-blind crossover study? Well, I want to assure you that there has been an in-depth study done, and more than 85% of what is prescribed daily in average medical practices has never been subjected to a double-blind crossover study. I suspect if I were in Ontario and CBC, TV, or whatever asked me to debate, they would find a doctor that would debate with me. Unfortunately, from Winnipeg to Victoria in Western Canada, they can't find anybody to debate with me anymore. And so it's rather an interesting thing. But don't get trapped emotionally, please, when physicians ask for a double-blind crossover study. I like Dr. Clark's comment. It is totally, completely, morally unethical. Ladies and gentlemen, I flew in for this meeting from Western Canada. I don't know how many other people got airplanes to get in here. And I'm also going to attend the training sessions. But I would like to tell you that if you think the young lady who described the bile duct cancer was exaggerating in any way what she was telling you about her father, I can assure you she was telling you the exact truth. I don't know her, I don't know her father, but I have guided an 86-year-old gentleman through precisely the same thing, a miraculous cure from bile duct cancer. And if you know anything about the cancer industry, and I know a little bit because I spent 3 years of my life as head of Director General of Cancer Treatment and Research in the province of Saskatchewan, and I know that they don't recover from advanced bile duct cancer. But her father did, and I was delighted to hear it. My friend is happy and healthy today. But another very interesting story I want to share with you, and I particularly want to share this with you, Dr. Clark, because it may make you feel a little happy in your heart. I have a very good friend whose last name I won't use. His first name is Bill, Dr. Bill. He, like yourself, has a PhD plus some other initials running off behind his name, and he is one of the top 20 medical researchers in the world. He travels all over the world to meetings. About 2.5 months ago, I was in the parking lot of the Safeway store, and I saw him walking across, and I hadn't seen him for some time, so I hollered at him and I said, "Bill, get your butt over here." So he came walking over, and he's put on a lot of weight. I gave him a lecture about what he was doing to his heart and that he shouldn't do that. And then I told him that he was neglecting his medical studies because he hadn't been in touch with me, and I referred to myself as a medical professor. And I said, now I want you to go down, before you buy your groceries, to this particular store, and I want you to buy the book, The Cure for All Cancers, written by Hulda Clark. And I said, by the way, Clark is spelled without an E. He said, okay, Professor. And I said, no, I'm leaving tomorrow to go to Vancouver to see some sick people. However, I want you to read that book because, Bill, I had a hell of a time with it. I sat up all night reading it after I got it, and my intellect is saying, no, this is garbage. And down in my heart, it's saying, yeah, she's got it. Well, curing the bile duct cancer for my friend shortly after proved me that Dr. Clark had it right. So I said, I'll call you, Bill, when I get back. I want to know what you think. When I got home, my wife and I went in the house. She switched on the answering machine, and the very excited Bill's voice was saying, "Doug, as soon as you're back, call me. I got something exciting to tell you." So I grabbed the telephone, phoned him. He answered the phone. And he said, "You know, that book's right. That Dr. Clark has got it, man. She's just thrown 85% of the materia medica that we've been taught at university right into the toilet and flushed it down the river." I said, "Bill, I'm delighted to hear that, because that was what I was coming up with, too." However, he said, "That's not the most exciting thing, Doug. 5 weeks before you saw me that day, I was in Paris at a medical meeting at an institute known as the Sorbonne. And while I was there, a doctor took me to the hospital and introduced me to a medical scientist, medical doctor too, who was laying in bed dying of inoperable brain cancer. She could hardly talk. She was having to be fed. Her cancer growth was extremely slow, so he said she was probably going to linger on for 4-5 months. He said, after I read that book, I grabbed my phone, I phoned Paris to the doctor, I told him what I had read, and I said, all I want is a promise out of you that if I go down tomorrow morning and buy those herbs in a package and the protocol and send them to you by Federal Express, that you will promise me that you will put her on it and you won't deviate. He said, Bill, send it. He said, Doug, I did. And 10 days later, just 10 days, he said, I got a phone call. And he said, Bill, it's like a bloody miracle. She's out of bed, she's talking, she's walking, and right at this moment, she's out walking in the park beside the hospital, feeling just great. Dr. Clark, you've given the world, humanity, a great, great contribution.